Matariki is the Māori name for the star cluster Pleiades, also known as the Seven Sisters. Matariki is also the name for an international network of 7 universities that are distinguished by their historic traditions and unique approach to facing contemporary challenges. The Matariki Lecture Series offers a short program of lectures addressing current research themes or areas of common interest.
This time, the lecture series is on race, racism, and decolonization, with a specific focus on racism and social determinants of health.
Yeah, first I'm muting, of course. Thank you so much for that kind presentation. Yes, I'm here in this fantastic collection of people and presentations representing Uppsala University, in which we have for 5 years been conducting research on racism at the very center of studies, multidisciplinary studies of racism, and in which I've been working. And well, we have a lot of research on the different dimensions of racism. One of them, and I'm very glad to hear Jill talking, because we are actually trying to build up a section of this multidisciplinary research on racism on Indigenous studies, and in particular on the colonial past of Sweden, which is not anything that people normally associate Sweden with, but there is a colonial past there as well, and it is very important, and we're trying to work on that past as well. But what I'm going to talk about today is health issues, and in particular the problematic issue of COVID-19 and the patterns of racialization or racialized patterns of in the contagious pattern, but also in the figures of the tragic deaths by this virus in Sweden as elsewhere, because we are very much observing a very common trend in Sweden compared to, for instance, the US, in which many studies have been conducted last 1.5 years, showing very clearly that the most affected populations are not only the elderly people, which are, of course, but also migrant communities or community, the Black American community, Latino community, and Asian communities. And that pattern has been observed at different places. And what we see today in Sweden is affecting in the same way, in a very similar way, the case of Sweden. And that's what I'm trying to show today. The Swedish Public Health Agency has come recently with a report showing these patterns that I will try to discuss with you, showing that people born in non-European countries, I would say the region, the Middle Eastern region, South European region, or West Eastern, Southeastern Europe, more specifically South America, are more affected by the contagious. But then, when we see that Sweden is quite at the quite upper position there, what we haven't. What they hadn't controlled was the variable of age. So of course there is a overrepresentation as well of the population, the elderly population, that have been particularly very hardly affected by COVID in Sweden. But then and this is the cases that have been requiring attention in the intensive care units, healthcare units, and the healthcare system has been more or less collapsing because of the very high necessity of intensive care in the healthcare in hospitals. And here we see that the pattern is when we control for age, we see that ethnicity and non-European background of the migrant population has some very much bigger incidence in the cases that have come to the intensive care units. And when we see more dramatically the figures for mortality with COVID-19 in Sweden, distributed again by the region of birth, we see that the situation is quite alarming, that there is a very clear pattern, racialized pattern of death in regarding COVID-19 in Sweden. So this report was really important for the public opinion, trying to understand why this is as it is. For us researchers on racism, and in particular in my case, with the small community of researchers in Sweden, having been dealing with segregation issues and racial discrimination issues during many, many years, more than 25 years by now, this is not a surprise. That is what we have been warning politicians for a long, long time, not specifically maybe talking about a pandemic, but talking about all effects that segregation and racial discrimination can lead to. So what we have been saying is that the complex pattern of the formation of segregation, of racial segregation in Sweden, which actually has put Sweden into one of the highest levels of racial and ethnic segregation in the OECD countries in several of the last years' reports, show that Sweden has, if not the most socially segregated pattern in these countries, yes, it is valid for the ethnic segregation. So that means that not necessarily the people living in segregated areas with a migrant background, that they are living in very poor conditions or very social detrimental situations, but they live very much concentrated in particular areas. And we have been talking about the process of racialization of the city, which is a very complex process involving state politics, involving the history of the racial history of the country, involving institutional, structural aspects of social and ethnic inequality, and in particular, and that has been one of my main research areas, involving urban planning ideologies and urban planning practices that necessarily have led historically to a pattern of a high segregation. In this process of racialization, one particular dimension that I've been working with is the process of stigmatization of both peoples and neighborhoods. So we can talk about the stigmatization, racial stigmatization over the migrant populations, in special, of course, people coming from non-European countries or non-white countries. And in terms of the stigmatization of the neighborhoods, that is what Louis Bacan in the US calls territorial stigmatization. And this is a process that has been very much mediated by news media. And it has, of course, a lot of consequences for the population, because it accentuates segregation even more than it had been the case without the media stigmatization. And then the most recent, and when I say recent, I say the last 30 years in Sweden and several other countries in Europe, and maybe as a global phenomena, we have seen the effects of the processes of neoliberalization, in which the welfare system that had characterized the country for so many decades has been seen a detriment. And all this very complex picture has resulted in an intensification of segregation and polarization, and very much worsened situation of housing, in particular in the areas in which COVID-19 has been hitting the population as the hardest groups. So very summarized, what we have seen in 1917s, we had the state was present in the neighborhoods and very much warranting that there were a kind of social equality, or at least a social evening politics. So the areas had a lot of service, commerce, public services. It was a very kind of ideal planning that was working because of the universalist welfare state. That was the case for Sweden. In the 90s, when neoliberalization started to show, what we see is the state starts to abandon the suburb, especially the stigmatized and racialized suburbs, and replacing general welfare by a kind of integration processes, because the problem was identified as the migrant population and not the state politics that were launched. In the 2000s, what we see is in a kind of paradoxical way that state and capital come back and work together, but not in the form that it used to be in the 70s, but in the form of more police presence in the areas and displacement, housing displacement through a process of renoviction, which is renovation by eviction or with eviction. Which is affecting the racialized suburban areas very, very hardly today, because those areas are in need of renovation. But in a neoliberal context, renovation is not happening as a kind of welfare policy. Is only happening on the conditions put by the private sector, very much guided by the will of making profit. So there is a very difficult situation in terms of housing quality and housing conditions in these areas today. And what we see, which is problematic, is that we don't see that that media today, and not even public servants, in the first place, are recognizing that the problem of the way in which COVID-19 is affecting in a differential manner the population, a racially differential manner, they are not willing to recognize, but instead they are once again blaming the victim, as we say within social sciences. They are putting the blame on the migrant population themselves. And the politics, what it's still called, very, very problematically, still called a generous policy of migration in Sweden, which was abandoned for many years ago. So it's not that generous anymore. But still, you know, the more right-winged and anti-migration and racist movements in Sweden, they are talking about a huge amount of migrants coming and threatening the stability of the country, which is not true. But what public servants from the Swedish Public Health Agency have been observed saying in the media that we have many immigrants in Sweden, that the problem is that we have those immigrants are working very much in healthcare sector, and in particular in the elderly care sector, and they lack language skills enough for understanding and following the guidelines for counteracting the dissemination and the contagion of COVID-19, which has been very much contested by organizations in which healthcare servants are actively participating, or saying that this is not the case. That what we need to see is the role played by structural inequality, and in particular structural racial inequality in the country. And as long as we don't recognize this problem, we cannot do anything for solving it either. So we have a very big problem on the report that I was referring at the beginning of the presentation is showing that there is a differential effect of COVID-19 in the population, and it's saying, but not expressing it explicitly, that we have a problem of some sectors of the population affected by this, but they are not willing to go further and try to find explanations in the structural problems of inequality, racial inequality, and social inequality in the country. So we have a lot of some challenges, and now I'm going back to my role as a researcher and the voices of the researchers. I think we need to activate ourselves in three particular issues, and one is the conceptual challenge. I think we need to start to talk about COVID-19 as a syndemic rather than a pandemic problem for a global problem. Syndemic in terms of that has to do with a very systemical inequality, the systems of inequality, structural inequality in the countries, in the different countries. We have a methodological challenge. We need to apply a lot of more and new forms of multidisciplinary research. And also in the use of methods, we need to combine much more quantitative and qualitative methods. And most of all, we have a political challenge. We have to watch for racist state biopolitics. We have to recognize in the first place that racism is affecting our populations with the result of differential death. Thank you very much.